Hi there! This video is for you if you found out that you or a loved one are at high risk of diabetes foot complications. My name's Tim Mulholland. I'm a podiatrist. I work at Pride Plus Health. In the past, I've had the experience and pleasure of working in a couple of different acute high-risk foot facilities. I currently teach at La Trobe University and have had a lot of different experiences helping people when they are struggling to manage high-risk feet. Let's get into it. When you have high-risk feet or high risk of diabetes complications, it's a sign that you've got some changes to circulation, sensation, and some lesion development. So circulation is the way that our heart pumps the blood all the way down to the feet. The blood carries all of that important nutrients, which leads to tissue growth and tissue repair, ensuring that bones, muscles, skin, and nails can continually keep growing and staying healthy. If we're at high risk of complications, there is a good chance that we're not getting enough of it happening and not enough blood is being pumped down through those arteries. This is something that your podiatrist will be very specific about telling you how much and what that means for you. If it's above, say, 30 millimeters of mercury on some important tests that relate to absolute toe pressures, you might still have enough blood to be able to heal an injury, but it's just going to take longer. If it's below that, and you don't have enough of that blood, then your podiatrist and then your medical team will be looking at ways to try and get some more blood flowing down. Next up, we're going to talk about sensation. So sensation is the gift of pain. While pain is so very visceral, very real, and very unpleasant, it is important, immensely important. If we lose sensation to the feet and become high risk of diabetes complications, and we can't feel pain, then we don't know if things are going wrong. If your shoe is rubbing, if you've stepped on something sharp and it's damaged your skin, if you can't feel it, you won't be able to apply first aid. If you then couple that with poor circulation, if you don't have the ability to heal, then this is that awful pathway where amputations can start purely from some superficial damage to the skin. So if there are sensation changes, it's very important that we do a few things both at home with your podiatrist and with your treating team. We'll get onto those in a moment. Finally, lesions. Now the lesions we're talking about are lesions on the skin that relate to friction and pressure. We're talking about corns and we're talking about callus. So a little bit of callus is protective. When we put friction and pressure on the skin, the outside layer of our skin thickens up a little bit, and that can stop some, blistering, some shearing away. Now, if it keeps building up and presses down deeper from the epidermis into the dermis, this can lead to ulceration and amputation. If you're thinking about what we talked about previous, if we aren't able to feel that, or if we don't have enough circulation to build quality skin or repair skin, then we can have a bit of problem, all stemming from a small callus or a small corn on the foot. So staying on top of circulation, sensation, and lesion development is incredibly important when we're at high risk of diabetes-related foot complications. Now, here's what we're going to break down and talk around as three different areas of your care team. The things we do at home, the things you do with your podiatrist, and the things you do with your overall medical health team. So let's touch on being at home first. So, if we're not able to feel things, we need to use our other senses. We've got to use those peepers a little bit more and look and check our feet really consistently. It needs to become more than a habit. It needs to become a passion. It's something that we're constantly looking at and encouraging other people in the house who are around, a loved one, a spouse, a carer, a family member. If you're not able to check the top and the bottom of your feet, get them to look. Hey, is my skin the same colour as what it usually is? Is it nice and consistent? If it's a fair skin, does it stay fair? If it's dark, does it stay dark? Are there any redness or blueness or changes to it? Those changes in the skin are really important. Utilizing a mirror or utilizing an iPad, something with a camera on to take photos of all different aspects of your feet so that you can closely look at it and see what's going on, vitally important. If something does go wrong, if you pick it up earlier in a foot check, you have the best chance at getting the best outcome down the line. Next up, let's talk about foot hygiene and skin maintenance. Really sexy topics, I know. So when we're at high risk of complications, our washing, our drying, and our moisturising become even more important. Washing your feet isn't just about standing in the shower and having the water and the soap run over it. No, those days are over. We've got to make sure that we're using a soap-free wash. So this is something that's got the natural acids the same as the skin, so it can donate that moisture into the skin while we are washing and while we are cleaning. Very important, because if we're thinking about that poor circulation, we're not getting it come down from the inside, so how much can we put in from the outside? It's a way to think about it. So with your washing, you're getting across the top of the foot and you're getting nice and in between the toes as well. If you're not able to reach, getting a sort of long-handled aid from the chemist can help out. Drying, just like your mum used to say, between your toes. Got to make sure that after you've bathed and you've got a good wash with the soap-free wash happening, then you get in between and dry any excess moisture. Sometimes our feet, through a little bit of the aging process, those toes become really close together and can become difficult to get in between there with a normal sized towel. So using a smaller towel like a face washer, again, if it's difficult to reach because they're all the way down there, using a long handle aid. Very, very important. Unfortunately, in my time in the high-risk foot, I did see many people who had developed nasty infections because of too much moisture in between the toes. Wash, dry. Finally, moisturise. Moisturise, no, not just for your face, for your feet. Unlike your washing and drying, you don't want to be putting moisture in between your toes, so you're not moisturising in there. Across the top of the foot, the underside, the plantar surface, around the back of the heel and the inside of the ankle are very important areas to keep nice and hydrated with a quality moisturiser. We're not talking sorbelines, we're talking about moisturisers that have got those natural acids that our skin absolutely needs. If we're going to go and talk about a few brands, you can find QV Moisturiser, Alpha Kerry Moisturiser and Cetaphil Moisturiser. All are readily available at a reasonable price point that will donate moisture back into the skin to keep it nice and soft and supple. When we're at high risk, this should be a daily thing. If we think about how the complications, so an ulceration or an amputation, how serious and significant they are, and how so many of them can be prevented with quality foot, we're talking the sexy stuff, foot hygiene, moisturising, washing and drying, spending that extra couple of minutes getting this done every day, really important. Next up, we're going to talk about nail care. When you're at high risk of complications, it's best to hand the nail care over to a professional, a podiatrist, somebody who is able to use sterile instruments and able to sit very close to your feet so that they can attend to nail growth, any skin lesions, safely and effectively. If we have that poor circulation and we're not going to heal up, it's extra important that we have somebody who is able to be very careful and considered for that. So when we are at high risk of complications, handball the nail care. Your podiatrist will be happy to help. Shoes or footwear. With high risk of diabetes-related foot complications, what's on our feet becomes even more important, and even checking them before we put them on becomes important. We can't afford to let blisters and lesions start to develop. So your podiatrist will most likely prescribe you or advise a particular type of shoe with a particular type of orthotic or inner sole to reduce any excess pressure on certain lesions. Your shoes will be comfortable and they will have some appropriate fixation. They won't be things that you just slip on. To slip into shoes, it makes your feet work harder, your toes claw at them to hold onto them, or they're too tight. They sit across the top. And if we can't feel what's going on, we don't feel that tightness, and we can have sorts of rubbing and lesions start to develop. So appropriate shoes with good fixation and a good orthotic in them become really important when you're high risk of complications. And finally, it might seem a little bit doom and gloom, but here's one that's actually fun to take care of: our physical activity. When we're at high risk of complications, it's extra important for us to make sure that we get 30 minutes of cardiovascular exercise for our feet every single day. So cardiovascular exercise includes things like walking, running, jogging, cycling, swimming, moving about where your heart rate just elevates. It doesn't have to go up to all the way to your maximum heart rate, but you're just getting up a little bit more than the normal. That consistent movement is great for your overall health, your mental health, your mood. You can believe how grumpy I'd get if I hadn't done my 30 minutes during the day. But it will also be very good for your feet. If we're not getting enough of the blood down there and the heart is pushing away, by being mobile on the feet, it's encouraging, it's drawing, it's saying to the heart, send me more, send me what you got, so we can try and make the most of our reduced circulation to get that blood flowing down to the feet. We also, on top of that 30 minutes of cardiovascular exercise a day, we need to get 2 sessions of resistance training done on our feet. Again, super important when we are at high risk of complications. So resistance training are things like weight training. So for the foot, we're talking about squats and lunges and calf raises, movements where you're putting a load through your muscles, your tendons, your joints, your bones, your blood vessels. This load is what's going to encourage them to be the best versions of themselves. It's going to encourage them to be as strong, as supple, as effective, if we're talking about vessels, as open as they can be. When you're doing these activities, your podiatrist will advise you on the best type of footwear and your orthotics to do them, but actually doing these at home is a great way to take charge and get also that little bit of a kick when you do those things, because you get those endorphins and it feels really good. Let's move now from home over to when you are at the podiatrist. What sort of a role is happening in this environment for your high risk of diabetes-related foot complications? So your podiatrist will likely be doing these foot risk assessments, your circulation sensation checks, every 6 or 3 months, just depending on where you fit in that overall risk level. They'll be looking to make sure that if you are at such a high risk with that circulation level, that it's not deteriorating further, that it's here, and putting in plans in place to see if it can be improved so your circulation can go up. Your podiatrist will be providing you assistance with your nail care, with any corns or callus management, encouraging orthotic use, getting you into the right shoes, getting you towards making sure that you're achieving your physical activity goals as well. Your pod will probably give you a little bit of moisturiser advice, a little bit of cleaning advice, and things that are really specific for you. It can be helpful to know that this is just not one-way advice as well. Your podiatrist is part of your journey and they will be there helping you with these things. So when you are at high risk of complications, that relationship with the podiatrist becomes a really strong bond where you spend so much more time together and your best health outcomes are really, really aligned with what your podiatrist is helping you towards. And that final team that we'll just touch on now is your overall healthcare team, which yes, your podiatrist is absolutely part of, but as is a few other key people. So you're at the centre, and pivoting and surrounding around that is your general practitioner, your doctor, who is also advising and prescribing, encouraging, being that supportive person there. You'll probably be seeing an endocrinologist as well for some more medical management. You'd likely be seeing a dietitian around what's the absolute best sort of fuel that we need to be getting into our system to help making sure that our high risk of foot complications is the lowest version of that, or even trending away from that as possible. And finally, an EP, an exercise physiologist, will be an integral part of your team. So EPs, they're a little bit younger as a profession than, say, us podiatrists who've been around for decades and decades, sort of developed out of the chiropody field. EPs are an exercise scientist where they've gone to uni for 4 to 5 years, learned all about the human body, all about drugs and interactions, all about different types of movement, and then it's all about prescribing those for you and your needs. So it might be relating to increasing the volume or doing exercises differently that don't cause strain on certain joints. It might be getting the exact right type of exercises for your feet and for you. So if we're thinking about that overall care team, there's you at the centre of it, your loved ones, your podiatrist, your GP, your EP, your dietitian, your endocrinologist, and your eye specialist. Sorry, I skipped over that one. Making sure those eyes are getting checked regularly as well to ensure that any more complications are picked up on and addressed. Okay, so this has been a serious chat. These are one of those ones when somebody has a high risk of complications, it's extra important for us to have this discussion and really understand just what's going on. And while the complications, that ulceration and amputation pathway is very serious, there's no coming back from an amputation. Things don't grow back. They are preventable in most cases. So knowing what our circulation, sensation, and our lesion development is, making sure we're staying on top of our foot checks and doing these other things at home, washing, drying, and moisturising, handing that nail care over to the podiatrist, getting the right shoes and orthotics, and increasing those physical activity levels, paramount. Getting into the podiatrist a little bit more regularly, ensuring that you're having those regular foot risk assessments, those circulation sensation checks, and you're getting that assistance with your primary care needs, your nails, skin care. And then having a great relationship with your entire care team, your GP, your endo, your EP, your dietitian, your podiatrist, all of your supporters, all of your people who want you to do the best. If we can stay on top of those, we can have this high risk of complications and lead fantastically healthy, enjoyable, active lives. I hope you found this useful. And if you'd like to learn a little bit more about diabetes and foot-related complications, more specific on actual what is happening with diabetes, not so much what sort of things are we going to be doing to manage it, you can check them out on our website, prideplus.com.au. Thank you.